Universal healthcare is a system in which everybody has access to a sufficient level of healthcare, including those who can't afford it. Universal healthcare is not the same thing as single payer. Single payer is a type of universal healthcare where coverage is provided by the government and funded through taxation. Another popular universal healthcare system is a mandatory insurance system, like we see in France and Germany. Everyone has to have health insurance, but lots of groups contribute, including the government, employers, and workers. This means that if somebody can't pay, the government or one of the other groups will make up the difference. In this video, we're going to look at the pros and cons of universal healthcare, which I've divided into 3 groups, which can be used as a criteria to measure other healthcare systems. First, you've got universality, which represents how much of the population is covered. Then you've got the price or the cost of the system, and the quality of the healthcare that's provided. Different systems give emphasis to one or more of these different criteria, as we'll find out. Let's get to our first group. The biggest pro of universal healthcare is in the name, universality. What this means is that everybody gets covered, no one is left uninsured. Something which doesn't happen in countries like the United States, which doesn't have a universal healthcare system. Universal healthcare systems can be funded through taxation, like in the UK and Canada, or like in systems in France and Germany, that insist upon each citizen having some sort of insurance plan, paid for by employers, the government, and people themselves. The benefit of this kind of a system is that if people can't pay, the government or one of the other groups will make up the difference. However, Germany's system differs slightly from that of France's, because the actual provision of healthcare, for doctors, nurses and hospitals, they're fully private, whilst being funded by the state. Regardless of which type of universal healthcare system a country uses, costs are shared out amongst everybody through a process called pooling, which means all the money is put into a common fund and used according to each person's need, and not based upon how much they can pay. A con of universal healthcare is that although this universality covers everybody, it doesn't necessarily cover all health conditions or treatments. In the UK, for example, which has a single-payer healthcare system, dentists and opticians have to be paid for by people past a certain age, and certain procedures not considered urgent by the NHS have to come out of pocket. As well as this, in a universal healthcare system, inequality of healthcare provision can still occur. Rich people can still pay for better or more quickly provided healthcare. This can be especially hard on the people left behind on government-provided or mandatory health insurance plans, because of the way a lack of competition there can reduce quality, but we'll find out about that later. Our next group of arguments concerns the cost of universal healthcare. In the French system, people can be reimbursed up to 100% of their healthcare costs, and the system is free at the point of use in Canada and the UK. According to the World Health Organization, per capita, the UK, German and Canadian governments only spent $5,000 on healthcare in 2015, whereas the US spent around $10,000. So ironically, in the US, for a country in which the government is supposed to have less of a foothold in the healthcare system, it spends around double what universal healthcare systems spend. This fact seems to contradict a con of universal healthcare that proponents of the free market system like to bring up. How can one honestly argue that universal healthcare systems are more expensive than free market systems when the US, which runs a free market system, spends more? Although one could say that this spending argument thus falls flat, the argument that there is a lot more bureaucracy in countries like Canada and the UK does seem to have some weight. As well as this, attempts to universalise the American healthcare system through Obamacare led to prices going up on certain insurance plans for the richest, which I think underlines one of the key differences between universal healthcare and free market healthcare. In a universal system, everybody pays what they can, with the rich thus being able to pay more. Whereas in a free market system in which healthcare is more like a commodity, people pay according to what they need. If they need more treatment, they pay more, regardless of whether they're rich or poor. Obamacare was an attempt to tilt the American healthcare system towards a more universal system where everybody is covered and people pay what they can, leading to the burden being placed on the rich through increased premiums, much like we see in systems that are funded through progressive taxation, like Canada and the UK. The final group of arguments concerning universal healthcare provision concerns its quality. Opponents of universal healthcare have argued that as well as the higher taxation, it leads to healthcare provision needing to be rationed so that everybody gets a piece. The argument goes that this rationing comes in the form of increased waiting times in universal systems. The UK, for example, has an 18-week limit on non-urgent or elective surgery, but this is often exceeded. However, the fact that countries measure waiting times in different ways, or that some do not have a national database for this, makes comparison quite difficult. Also, if we look at national indicators of healthcare quality, like life expectancy and infant mortality, OECD statistics show that the US's system falls way behind universal systems. However, one could argue that at least in a free market system, consumers are able to vote with their feet and go for other options, thus improving the system through competition. The inability to do this in universal systems can be represented as particularly unfair when we think about how the richest in society can do exactly that. They can bypass NHS waiting times by buying private healthcare, whereas the poorest in society cannot. To conclude, the main pro of universal healthcare is that it provides a certain level of health coverage for everybody, with the costs being helped for those who can't pay. Contrary to arguments that this lowers the quality of healthcare through rationing, statistical measures of health by country, such as life expectancy and infant mortality, shows countries such as the UK, Canada, France, and Germany outperform the US. However, money does have to come from somewhere, usually via higher taxes in the previously mentioned countries, excluding the US. As well as this, complete equity of healthcare does not exist in universal systems. Rich people can still buy better healthcare. Add to that the fact that with greater government influence in the healthcare system comes a lack of choice to the consumer, as well as greater bureaucracy. What do you think of universal healthcare? Put your opinions in the comments section. And don't forget to like, share, and subscribe. Thanks for watching.